Well, the Southeast Asian office of the World Health Organization is calling on governments to ramp up their public health measures against monkeypox. And that includes speeding up efforts towards vaccine research, along with stepping up infection prevention and surveillance in hospitals and clinics.
I have decided that the global monkeypox outbreak represents a public health emergency of international concern.
A global health emergency that's incrementally but worryingly spreading in Asia. More than 16,000 cases of the disease have now been reported worldwide. Just a fraction of those infections have been detected in Asia, but it's enough to cause alarm. Singapore has reported 2 more cases of monkeypox, bringing its total to 8. Both were admitted to the National Centre for Infectious Diseases after developing rash-like symptoms. Thailand also on high alert after a Nigerian tourist was diagnosed in Phuket. The man who fled to Cambodia on Thursday has since been arrested. From that one case, 19 people were deemed high risk. 12 have returned negative, and results of 7 others are expected this week. Authorities are urging the public not to panic, assuring there's enough medicine and facilities to treat patients if the virus spreads. Similar calls for calm in New Delhi after the Indian capital reported its first case, increasing infections in the country to 4. Unlike previous cases, the 35-year-old man had no history of foreign travel. Local media say he attended a stag party recently in Manali in Himachal Pradesh.
भर्ती होने से पहले इसको फीवर था और टिपिकल स्किन के रैशेस थे। इसकी क्लिनिकल कंडीशन को देखते हुए क्योंकि ये संभावित या सस्पेक्टेड मंकीपॉक्स का केसेस था तो इसको हमने ऑब्जर्वेशन में रखा और इसका जो स्किन से जो टेस्ट है और इसके साथ साथ जो ब्लड का टेस्ट है वो हमने इसके सैंपल्स नेशनल इंस्टीट्यूट ऑफ वायरोलॉजी पुणे में भेजे और उसका परिणाम आ जाया है जो कि पॉजिटिव है।
Other countries in the region aren't taking any chances. China, Malaysia and Indonesia have moved to step up control measures for inbound travellers. All 3 nations have yet to report any new infections linked to the virus.
A widespread vaccination for monkeypox isn't on the horizon in Singapore, even as more infections are confirmed in the country. Health Minister Ong Ye Kung says jabs aren't recommended at the moment as benefits do not outweigh the risks. And that risk is low for the general public, according to both the Health Ministry and health experts CNA spoke to.
2 more cases of monkeypox infection confirmed by the Health Ministry over the weekend, bringing the total to 8 confirmed cases in Singapore so far. Despite this, experts say there isn't any cause for alarm. Unlike COVID-19, monkeypox mainly transmits through close physical contact, so mass vaccinations for the population are unlikely anytime soon.
We already are vaccinating close contacts of people with that have been near cases. So those people are recommended to get vaccination even though they could have already been exposed. And this is what we've seen in many other practices, including Ebola. You vaccinate the contacts or you vaccinate the contacts of the contacts. The next step up from that would be vaccinating those at risk. But I think we're a long way away from vaccinating the whole general public.
In addition, the Health Ministry is looking to raise awareness of transmission among at-risk communities, including those engaging in high-risk sexual activity. Health experts caution this must be done with sensitivity.
The key thing is to avoid stigmatizing this community even further, even as we reach out to reduce potential exposure to the virus and try to get people to seek healthcare early.
The World Health Organization had on Saturday declared the outbreak a public health emergency of international concern, the top alert available to the international health body to tackle a global disease outbreak.